Hello, my name is Adam Stewart. I am a student at University of Charleston in Beckley, class of 2022. And today I'm going to be going over the TCDB and Splinting, the Spirometer, and the leg exercises for post-operative. First off, I am going to go over the splinting. It is the easiest to go over. This is for any abdominal incisions, like for abdominal surgeries. You would have to set them upright in this, like either in the bed, or if they're able, they could sit in the chair, just anything that's comfortable for them. In this, if they needed to cough, you would kind of keep the pressure off the incision, so you'd give them a pillow or a folded up blanket and tell them to apply firm pressure to the abdomen if they need to cough, and let them cough, and you would notice that the pressure would be off the incision. It'd be more into your arms here, and it'd keep the incision from splitting open and causing eviscerations, which is a big no-no. You don't want that. But yeah, that would be the splinting part of it. The TCDB, or the diaphragmatic breathing, would be a good exercise. I would teach them probably pre-operative and post-operative, just to give them a little heads up of what to expect in their surgery. Pre-operative, you would tell them to you'd have to set them upright, and in these cases you would obviously do the things that you would do normally. You would do the hand hygiene. You would probably don gloves and maybe a mask with some of these, because it would involve coughing in some of these, so I would probably wear a mask to protect myself. You would do the 2 factors of identification, like their name and date of birth, and all these. So just assume that you are doing these as I'm going along. But yeah, you would instruct the patient that you'd have to sit them upright, either in high fallers or upright or in a chair. And for the deep breathing session, you would tell them to take some deep breaths. You would first you would tell them to put their hands on their where their diaphragm is. It's just right underneath the rib cage. You'd feel it right where the diaphragm sets, and kind of have your hands pretty close together, like almost the middle fingers touching, and tell them to breathe deeply through their nose and hold for about 3 seconds, and then let it out. And you would instruct them that they're going to feel the diaphragm move down because of the negative pressure that the diaphragm has to make for the lungs to expand. So you'd instruct them that they'd feel the diaphragm move down, and also don't let them use their chest muscles and shoulder muscles that much. It's more of a diaphragm breathing than it is the intercostal muscles and stuff like that. So you instruct them to take some deep breaths through their nose and out their mouth, and then you do that probably 3 to 5 times an hour, like every waking hour that they're there, just to strengthen the lungs and the diaphragm, get it going, get all the sputum that's in their chest, because usually these patients aren't going to be able to ambulate. They ain't going to be able to move, and sitting around and stuff without this breathing could involve some respiratory problems, lung problems. So yeah, this is very important. Another part, like this is kind of like a substitute for this deep breathing. It's a machine called the incentive spirometer, and it's a pretty handy device. You can use it with the deep breathing I just went over, or you can just use it as a substitute, which is pretty fun. I kind of use it as a little game. I've been messing around with it a little bit. It's not really much of this part. It's more of this ball. There's little arrows here, and you got to put this blue piece in the middle for about 3 to 5 seconds. And you would put this patient in the same position you would as the deep breathing technique. You'd be upright, high fowlers, or in a chair, so their diaphragm can move freely. And you would instruct them to place their mouth on this mouthpiece and blow, suck in. And breathe out. And they would do this probably about 5 to 10 times an hour. And it's pretty much the same thing as the deep breathing, but just more fun, easier to handle. And you do that about 5 to 10 times, like I said. And that's pretty much it for this. I mean, it's pretty self-explanatory. This strengthens the lungs as well, as it kind of like releases some gunk in the lungs, like sputum. And yeah, it's a pretty handy tool. I like it. Next, this is a step kind of after you do the spirometer or the deep breathing. It is called controlled coughing, which is kind of like it breaks the sputum out of the lungs that you have broken up with this or the deep breathing. To do this, you would have him in the upright position as well as you would that, and it would start off like the deep breathing. You would take some deep breaths through the nose and then hold for 3 seconds and then out the mouth. But on the third time, you would tell them to hold it, and then whenever they're about to exhale, to cough 3 times to break up any of that stuff. And most likely some sputum will come up. If not, then you would probably do this probably once an hour, this technique. And if you want a specimen from them, this would be a good way to get that, is with this controlled coughing. If you do need a specimen, it's good to have like a specimen cup, so you'll be ready to take it. If not, you can instruct the patient to kind of be vigilant, like if they're there by themselves and they come up with sputum, just to look at the consistency, the color, the odor. If it's like a green or a yellow, that could indicate infection. A normal sputum is usually clear, white, or gray, so you wouldn't really worry if it was that color. Red could indicate infection, or maybe, like in rare cases, tuberculosis. So it's really important for them to let the RN know about any abnormalities with their sputum. So yeah, you can instruct them to let you know if there is something like that occurs. Alright, and that would do it with the controlled coughing. And next would be the leg muscles. I don't have a guinea pig today, so I'm going to use Mr. Woodley. He is my kind of like my artistic friend. He helps me draw. I can put him in different ways. So he's a very good candidate for this. Not very good with the ankles. I tried playing around with him earlier, but he bends pretty good. But the for the leg exercises, this is a post-operative technique as well, where they can't ambulate. The patient normally can't ambulate after surgery. This is a good way to keep the muscles of the leg, some circulation going with them and some strength. You would lay them in a supine position, and if not, just close enough, like maybe a low Fowler's position, just enough to keep the legs straight. And you would instruct them what you're doing. Of course, you'd say, hey, like if it was me, hey, I'm Adam. Hey, Mr. Woodley, I'm Adam. I'm here to do leg exercises to do your circulation in your legs, kind of strengthen your legs up where you've had the surgery. And yeah, you would first start out with the legs, well, the ankles to be specific. You would grab one ankle and you'd kind of rotate it in a circle one way. You can either start left or right, it don't really matter. And his ankle don't really, like, you can't really see it, but just imagine this is an ankle, and you would kind of twist it in a circle, you know, kind of rotate the ankle a little bit. You'd do that about 5 times one way, and then 5 times another way, to kind of get the circulation and the joints kind of loose, you know. You do it 5 times for one ankle, and then 5 times for the other ankle. And once you did that, you would go to the calf muscles, which on this one you would have one leg here, have it straight out, and they would do a dorsal flex, which would be them pointing it toward the body, their ankle toward the body like this, like this, pointing toward the body, and then a plantar flex, which is them pointing it away from the body. So you do that 5 times. You'd go up, down, up, down, up, down. And that kind of flexes the calf muscle. You actually instruct the patient about that. Be like, hey, you're going to feel your calf muscle flex and relax. Flex and relax. It kind of gets the calf muscles working, gets the blood flowing in the calf muscles. And then once you do that one, you will move to the thigh muscles, which is kind of hard to explain. It's kind of like stretching your leg. Like, you ever wake up in the morning and like you stretch your legs, you know, get some blood going. That's pretty much what this thigh exercise is. You'd kind of straighten your leg out like you're laying flat. You'd kind of lift your leg up and stretch it, and then you'd lay the leg down, stretch, lay it back down. You do it 5 times for each leg, and that improves blood flow to the thighs. And lastly, you'd have them laying down, and this one would be like the whole leg. It's more like the thighs and the calves, more, really. But in this one, you'd have them flex their knee upwards, kind of like this. You'd have them stretch your leg up, raise it up, flex their knee toward the body, and stretch it back out, lay it down. You do this 5 times. See how flexible Mr. Woodley is? Alright. And you do that 5 times for each leg. And that would be all for the leg muscles. Yes. But yes, this is that was all for the leg muscles, and that is it for this video. I hope you learned something, and I'll see you on the next one. Thank you.